new treatment mechanism that I will discuss today is a method to cause the following three effects at the same time: mechanical effect, needle RF effect, PLA drug delivery. This method decreases downtime with a better treatment effects. The content of the lecture are as following: all the pathology, traditional acne scar, PLA, and special design needle RF, and my treatment method and clinical photograph. And pathology, already you know, acne picnic scar classified in the box ice peak, rolling according to shape. The cause of these shapes are slightly different, but we don't know precisely the cause of this variation of depression. The pathology of the acne scar indicate that the skin appendages are lost and dermal layer is thinned. In most cases, it observed that elastic fiber is reduced or lost, and reticular infrastructure, so their shape is similar to sponge. There are two sides, less than 80 micrometer, less than 50 micrometer. About 80% of particle volume contain air. For this region, nodular side effects are rare when both drugs are used at the appropriate concentration and scale. Comparing two PLA, PDLA is softer, as a low glass transition temperature and softening, and remains in the tissue for a shorter time. In addition, the PDLA can be applied clinically various ways using these properties, because the glass transition temperature is softening temperature drop to 40 degrees from 50 degrees Celsius after hydration. This figure is a part of a recent submitted manuscript regarding PDLA. In vivo, confocal microscopic finding of PDLA injected mouse show adipose-derived mesenchymal stem cell. This is a green color, proliferation and differentiation after 2 and 4 weeks. The changes are more prominent compared to HA injected mouse. The most prominent increase was observed after PDLA injection samples. This is a human finding, mesenterochromic staining image before and after PDLA injection, strong positive finding. And histophalangic finding after intradermal injection PDLA shows the increased elastic fiber after 6 months. New equipment is designed to improve the energy transfer mechanism by attaching two energy generator alternately to deliver energy evenly, so make even coagulation. A new CP25 tips is used for make 1.5 millimeter deep injection on pig skin, and you can observe that 0.5 milliliter of drug was delivered. CP16, CP25 have a thicker diameter of 350 micrometer, so that the volume delivery increase. For regeneration ability in treatment by needle RF, needle RF has a more significant increase in elastic fiber and collagen compared to erbium glass laser. In addition, solid physical needling can also be means of elastic fiber regeneration, so simple needle procedure is also essential. This paper from India reports the result of alternating treatment using bipolar and monopolar RF. Monopolar RF was used twice for deep.
And nowadays, we even can use it to treat hypertrophic scar, dilated pore, and some stretch mark, especially the striatal outburst. So the treatment that I just mentioned earlier is a technique called picotoning. So picotoning is very much similar to the old fashion of so-called low fluence Q-switch and the toning. But the only difference in my experience is the rate of side effect, especially the confetti-like hypopigmentation. In the past 4 or 5 years, after I used this picotoning technique, I still haven't seen any case of hypopigmentation. Whereas in the past, whenever you use low-frequency Q-switch and iliac laser to do so-called laser tuning, there have been quite a few studies showing that about 14 to 15% of the patients develop so-called confetti-like hypopigmentation, which become permanent. So this is the technique that I just mentioned, picotoning. What we use is we use a big spot size of 6 or 8 millimeter. And
yes, I agree with Davin. And in fact, I do subcision periodically, not as frequently as what you have done, because some of the scars, I feel that if you do any other procedures and laser procedure, you are not going to release the fibrosis that's anchoring down the depression, and therefore it's quite useful. And the other technique that I use quite a lot is the cross technique for ice-pick scars, because you can do anything to it, you find the ice-pick scars will remain otherwise. And you just do a bit of a cross technique with the TCA, you can sort of elevate and loosen the fibrosis, and then you can follow with the laser procedures. Yes, Woraphong?
Yes, these questions go to Dr. Seo, Joseph Seo. You use fractional RF as a drug delivery for polylactic acid, right? Can you tell me what is the molecular weight of the polylactic acid that you use?